Hello, I'm Nurse Rose. I'm here for your ear cleaning. The doctor ordered an ear cleaning. Oh yes, I'm right here on the schedule. That's me, Nurse Rose. Is this your correct pain level? Oh my, I'm so sorry you're not feeling well. Is that your ears or your trouble breathing? Both. Well, hopefully after I clean your ears, we can get that pain level down a bit. That would be good. Yes. Can you state your name and date of birth for me? You're the correct person. That's you. I'm going to get some of my stuff out and set up a bit. This is my tub. I carry this around the hospital with me. It has everything I need to do my job. I'm going to set some stuff over here. Have you had any allergic reactions to anything? Okay. Well, let me just go over the procedure a little bit. I'm going to be very close to you. And I want to make sure that if you ever feel uncomfortable in any way, I want you to let me know. Because I want this to be a relaxing experience. I do need you to be still, very still, because I'll be in your ears with some of my tools, and I don't want you hurt in any way. I want it to be relaxing, but also know that you need to be still. If you get the urge to sneeze or cough, just alert me so I can stop what I'm doing. You know, don't ever not want to alert me or feel weird about it, or don't at all. I'm a pretty down-to-earth person, and I want you to have a good experience, and I want to help you and get that pain level down. All right, so I'm going to sanitize my hands. Seems like that's all we ever do nowadays, huh? Sanitize our hands. Oh, I see you have a respiratory therapist coming after me. I think I know who you'll have, and she's really, really great. Yes, she's great. I'm gonna get my gloves on. All right, we're ready. I'm going to get my otoscope out. Get you a new clean tip. Your tip on Otoscope, and we're ready. I'm going to use this to take a peek in each one of your ears Right. It has a light to help me see. I'm going to get close to you now, like I was talking about. Now, I'm going to pull up, back on your ear. I'm going to insert my otoscope. Yes, I see a lot of impacted wax. It's a lot. I can't even see your eardrum. I'm gonna pull it out now. Were you having trouble hearing? Yes, I can understand why. And I'm very sure I'm gonna fix that for you. Okay. All right, let's look in your other ear. I'm gonna do the same thing. I'm going to pull up, back. I'm going to stick my otoscope in your ear. Okay. Yes, you have a lot of cerumen in here too. Oh, that's just a fancy word for wax. Yes, a cerumen impaction. Alright, I'm coming out. You do have a big impaction of wax. I'm probably going to use a few different tools. First, I'm going to put in some drops, and that's going to break up the wax and soften it. And after the drops, I'm going to probably, I am going to do a flushing with some warm water. Yes, I have this. It's more of like a spray. I'll show you when we get to that. Don't worry, it works wonders. And then after that, I'm going to go in with my little tools, and I'll show you those. And I'm going to tell you everything I'm doing along the way. And remember, if you ever feel uncomfortable, that's right, just let me know. I'm going to put your drops in. Here we go. We're going to put a few drops in here. A few more. And just one more. How are you doing? I know that feels strange, but we're going to get that wax out of your ears. I'm going to put the ones in the other ear. Here I go. A little bit more. Okay. There we go. Now that your drops are in, let that sit for a minute. I'm going to get some of my tools out. my tools. Who would have thought so much went into just your ears? But that's what I do. I go around the hospital, and anyone that needs anything to do with their ears, I come and check on them. All right, I'm going to take a peek in your ears, see how the drops are doing. All right, I'm going to pull up and back, inserting my otoscope. Okay, I'm coming out. Let's check your other ear. I'm going to pull up and back, inserting my otoscope. Oh yeah, the drops are working really well. Alright, I'm coming out. Now I'm going to get my things ready for your flushing, or ear irrigation. That's what it's called. I'm going to take my spray bottle and take the tip off. I'm going to put a special tip on. This is going to go in your ear, and when I spray the bottle, it's going to push water into your ear. It's supposed to have a little force to it, but you have so much wax in your ears that we need that force, and it's perfectly safe. All right, so this towel, I don't want to get you all wet, so we're gonna put this, let's start on this side. We put the drops in this side first. The towel right here. Right, towel's on. Take this, your ear is going to sit right here. Here we go. I'm going to put it under your ear here. Okay. You want to hold it a little for me? Yeah, thank you. And let's just get to it. Going to stick this in your ear. Second. You always think you have everything ready. Okay. Now, here we go. There we go. Go a little faster. And it is definitely working. Are you all right? Good, good. That's really good. Okay, I'm gonna stop. That did really well. There's definitely a lot of earwax stuff in here. Let me Get rid of that water in the sink. Okay, now we can do your other ear. Let's take your towel. Drape it right over here. All right. Take your, put it right under this ear. All right, you have it? Gonna hold it? Okay. Gonna stick this in your ear. I'm going to begin. How are you doing? Good, good. Gonna go a bit faster. A lot in this ear. Okay. All right. Okay. Let me get that from you. Let's not drop it. Okay. Put that over here. Take your towel off. Oh, you got a little wet here. A little wet over here, just a little. Here we go. Always get a little wet doing this. Okay. All right. That was an experience, huh? But you're okay? Good. I'm gonna take a peek. Alright, up and back so I can see down that ear canal. Here we go. I'm gonna insert the otoscope. Oh, yes. I'm gonna go a little deeper. This looks so much better. I can't quite see your eardrum yet, but it looks better. Alright, I'm coming out. Let's check this ear. Up and back. Inserting my otoscope. I'm going to go a little deeper. I can see your eardrum a little bit, but I'm coming out. The water flushing did really, really well, but I'm still going to have to go in with my tools. And the first tool I'm going to go in with, I will show it to you, is this tool. Here we go. Gonna move it around in here. Next, I'm going to go in with this tool. Alright, here we go. I'm sorry if these feel cold. And lastly, I'm going to go in with my scooper. And this is the best tool getting earwax away from your the sides of your ear canal. All right, I'm going in. I'm gonna scrape. Been doing this a very long time, so I do it pretty quickly. Right. The shorter the patient has to sit is helpful. Take a look and see how much I've got out there. Up and back, inserting the otoscope. I'm going to go a little deeper. That's what I want to see. A nice, healthy, tympanic membrane, your eardrum. It is a light grayish color and it looks perfect. Alright, I'm coming out. That ear looks great. Do you notice a difference? Let me do your other ear and then I'll ask you that question. All right. I'm going to take the same tool, this one. Here we go. You know the deal. You know what to expect. All right, here we go. Next tool is this one. This one works wonders. Okay, I'm going in. My favorite little tool, my scooper. Let's going to check your ear. I'm going to pull up and back. I'm inserting my otoscope. I'm going to go a little deeper down your ear canal here, which looks much better. And I can see your tympanic membrane, and it is a light gray, healthy color. Alright, I'm coming out. How do you feel? Can you hear better? Do you notice that at all? Oh, you do. That is great. Everything probably seems all loud now. Oh, that's my job. This is what I do. And I really enjoy it. So you're good? All right, well, I'm going to clean your ear. I kind of made a mess, okay? I'm going to take my spray, and I'm going to spray the outside of your ear, and I'm just going to clean it up a bit. Okay. Get my towel again. I'm going to hold it up while I do my spray. I'm going to hold the towel up to your ear so don't get it all over you. Here we go. There you go. Spray your other ear. Take a wipe. Let's wipe your ear. Just the outside and the back. I'm going to flip it and wipe the back. Front. Okay. I'll do the same thing on this side. I'm going to flip your ear and wipe the back. The side, front. I'm going to take like a Qtip type. It's like a big Qtip. I'm only sticking this in the outside part of your ears. Wipe around the contours of your ear. Okay. Gonna wipe around contours of your ear. And we're done. You're feeling better? That's great. You can hear better. That's awesome. Well, I'm going to pack up my stuff, and you probably have an hour rest before your respiratory therapist comes. Sounds like you need her. Yeah, she's great. But I'm happy. I'm so happy you're doing better. Your ears don't hurt. Yeah, that was a lot of wax. You should probably, if you get a lot of wax in your ears, which it looks like you do, you should probably schedule regular ear cleanings. Yeah, that's a thing. Yeah. And they won't be backed up so much, and we wouldn't have to do the, whole thing that we did, but that's something you could try. Well, I'm happy to service you today, and I hope your stay at the hospital is a good one. Bye.